Hi everyone, my name is Nancy Tran, registered dental hygienist and Burr Senior Ambassador. Today I'm at my dental office and I had a dental procedure done, which a lot of you may or may not be familiar with. Have you heard of crown lengthening in dentistry, or have you ever been told by your dentist that you needed one prior to placing a crown on your tooth? Well, let's talk about crown lengthening, what it is, who benefits from it, and under what scenarios would be the case where you would get crown lengthening done in the dental office. So what is crown lengthening? Crown lengthening is exactly what it sounds like. The procedure of lengthening your crown. It's a common procedure. Ideally, it's going to reduce the gum tissue in the mouth, or sometimes even the bone of the tooth, to help present a longer clinical crown, so that for whatever reason, if you have a gummy smile or if you need to have a crown placed on the tooth, it's biologically ideal, so that you don't have any issues in the long term of having gums, infected gums, inflammation, or even bleeding around the surfaces of your tooth and your gums. So there are typically two scenarios where a patient would be recommended to have crown lengthening done. Ideally, the more common procedure is if you're having a crown that's done in the mouth, you want to make sure that you have enough tooth structure to accommodate the crown so that you don't invade the biological width. Ideally, when you place something over your tooth surface, you want to make sure you have at least 2 millimeters before it touches the gum and the bone. So if a crown is going in the mouth, we want to make sure that there's a separation of the crown margin and where the bone sits of 2 millimeters, or else you're going to have long-term inflammation or retention issues where that crown actually might just pop off. So think of a Lego. When you're playing with the Lego set, in order for the Legos to attach to the base of the Lego set, you actually have to have a nice nub for the Legos to lock into. For whatever reason, if those little nubs or the Legos get worn down, they snap into place, but they pop right back off. So that's exactly the same thing that would happen if you place a crown in the mouth on the tooth that doesn't have enough biological width, where we need to lengthen that tooth, bring that gum below the tooth surface so that you can actually have a better retention for the clinical crown and the placement. The second scenario, for example, like myself, it's more aesthetics. So when you have a gummy smile, also known as altered passive eruption, that just typically means where your tooth is actually a lot longer, but your gums are covering a good portion of your tooth. So the clinical crown lengthening for aesthetic purposes is just reducing and recontouring that gum tissue, and you can see the before and afters here. We'll also include a video of my actual procedure as well. It can be done whether the old-fashioned traditional way is doing it by scalpel, cutting away the gum tissue, or now the more modern technology, such as using lasers, allow you to reduce that gum tissue in the mouth with very, very low recovery times. So what typically happens before you do a crown lengthening procedure? Before a crown lengthening procedure happens, we want to make sure that we actually have all of the proper x-rays and the periodontal measurements. The periodontal measurements are pretty much the measurements from your gums before you touch the bone. That tells us the true biological width that we have to work with. So typically in my case, I had my smile with my measurements 1, 2, and 3 millimeters, but I was able to have at least 1 to 2 millimeters removed so that my tooth was longer when I smiled. I was a little bit more self-conscious. You really can't tell, but I'm a big believer in a millimeter in the mouth is like a mile, because it's not a lot in terms of measurement, but it makes a big difference when it comes to taking photos or videos. You can really see. Before, when I smiled on my right side, you can see between 3 different teeth that I definitely showed more of my gums when I smiled. But now I'm about 1 month post-op on my procedure, and when I smile, you can see the before and afters. It's a huge difference. Sometimes they are referred to as crown lengthening, and other times it could be referred to as gingivoplasties. It just really depends if they're removing bone with the dental procedure when they're doing the crown lengthening. Sometimes insurances will cover it, but for the most part, you can anticipate that it's not going to be covered just because it's hit or miss. Sometimes the insurance companies will consider it as a cosmetic procedure. Other times, even if it's necessary, insurances really don't help patients cover it for whatever reason. Post-op wise, I was done It was done under local anesthesia. I had very, very minimal post-op pain because I did laser with a little bit of bone reduction. I recovered within the week. I didn't have any severe pain or swelling. And overall, I'm pretty happy with the results. A little bit of sensitivity to hot and cold for the first 2 to 3 days, but that subsided. And major risks, I don't think there's any major risks when it comes to that. No different than any other dental procedures that you have done. So that's pretty much what I had done today. Clinical crown lengthening, but mine was more for the aesthetic purposes. I didn't have any crown or bridge work done. It was just really to take care and balance out my gums or my gummy smile. So you really can't see as much anymore. So I'll leave the before and after photos here, and then please enjoy the procedure photos in case this is something that you considered having done and you weren't sure exactly if that was even an option to have done. I just want to share my personal experience as a dental hygienist, as a patient, and you know, hopefully seeing the before and afters can kind of help answer any questions that you may have. If you have any questions, please drop them down in the comments. Make sure you subscribe for future YouTube content.